Definitions. What informed consent and assent mean in research situations. Informed consent is a formal and legal process used in research when a person is able to make decisions for themselves. It is not just a signature on a paper. It is a process where the researcher explains the study step by step. The participant learns why the study is being done, what procedures will take place, how long it will last, and what risks or discomforts may occur. The participant also learns about possible benefits and how their information will be protected. In a hospital research study testing a new therapy, an adult patient is first given the consent form to read. The researcher then explains each section of the form, including the purpose of the study, the treatment steps, how long participation will last, and what medical tests will be done. The form also clearly lists possible risks, such as side effects or discomfort, and explains any possible benefits. It includes information about privacy, how medical data will be stored, and who will have access to it. The patient is encouraged to ask questions and is given time to decide. Only after fully understanding the information does the patient sign the consent form, showing informed and voluntary agreement. Assent, on the other hand, is used when a participant cannot legally give consent but can still understand what is happening. This usually applies to children, cognitively impaired adults, or those with temporary mental limitations. Assent means the child actively agrees, not just stays quiet. When a child is involved in the same hospital study, the parent or guardian signs the consent form on the child's behalf. After that, the researcher speaks directly to the child using simple and age-appropriate language. Instead of reading the full consent form, the researcher explains what will happen in a way the child can understand, such as describing simple procedures or how the treatment might feel. The child is then asked if they want to take part. A clear yes shows assent. If the child looks uncomfortable or says no, the child does not participate, even though the parent already signed the consent form. This shows how consent protects legal rights, while assent respects the child's understanding and choice. Who gives consent and who gives assent? One of the most confusing issues in research is understanding who is allowed to give permission. Informed consent is given by the parent or legal guardian, not by the child. This consent gives legal permission for the child to be included in the research. Assent is given by the child, not the parent. Assent shows that the child personally agrees to take part and understands the study at their level. For example, in a school-based education research study testing a new teaching method, researchers first send consent forms to parents. Parents read about the study goals, classroom activities, data collection, and privacy rules. When parents sign the form, they give informed consent. After parental consent is obtained, the researcher talks directly to the students. The researcher explains the study in simple words, such as saying the class will try a new learning activity and answer a few questions. If a student says yes, the student gives assent. If the student says no or looks uncomfortable, the student does not participate, even though the parent already gave consent. Ethical research requires both parental consent and child assent for participation to continue. What information is shared and how it is explained. Another area people struggle with is how much information is given and how it is explained. Informed consent includes detailed and sometimes complex information. Adults are told about study procedures, experimental treatments, possible side effects, alternative options, and confidentiality. This information is often written and reviewed carefully. Assent is different because it focuses on understanding rather than legal detail. For example, in a clinical drug trial, adult participants are told how the drug works, how often it will be taken, possible side effects, and what happens if problems occur. A child in the same study does not receive all technical details. Instead, the researcher might say, "You will take medicine and we will check how your body feels. You can stop if you feel uncomfortable." The goal of assent is not full scientific knowledge but honest and clear understanding, voluntary participation, and avoiding pressure. Many people think that offering rewards makes research fair, but this can be a problem. In both informed consent and assent, participation must be voluntary. This means no pressure, no threats, and no excessive rewards. For example, in university research, students may be invited to join a study. If participation affects grades or academic standing, students may feel forced. Ethical research avoids this by offering alternatives. In child research, pressure can come from authority figures such as teachers or doctors. If a doctor strongly pushes a child to agree, assent is not truly voluntary. Even offering expensive gifts can influence decisions unfairly. Ethical research ensures that participants feel safe to say no without negative consequences. Right to refuse or withdraw at any time. A very common misunderstanding is that once consent or assent is given, it cannot be changed. In reality, informed consent and assent are ongoing processes. Participants can withdraw at any time, even after the study has started. For example, in a long-term psychology study involving interviews, an adult participant may initially agree but later feel emotionally uncomfortable. That person has the right to stop without giving a reason. In a child study, a child may agree at first but later become anxious or upset. Even if parents signed consent forms earlier, the child's refusal must be respected. Researchers must immediately stop involving the child. This rule protects dignity, trust, and ethical standards in research.